everyone, I'm Esther from Skylark First Aid, doing a little video today about how to treat bleeding. This is just minor bleeding, so this isn't heavy or catastrophic bleeding, so it's minor small wounds that are bleeding that we need to stop. So a good way to remember how to do this is to use the acronym, we love an acronym in First Aid, SEEP, S-E-E-P. So first of all, sit the person down or lie them down if you need to, especially if you think they're a bit funny with blood and you think they're going to faint, then sit them down or lie them down so they don't hurt themselves if they fall over. Then you need to expose the wound. So if it's under clothing, get some scissors. Your first aid scissors out of your first aid kit are perfect because they're blunt edged, so you're not going to cause another wound, and cut round the injury. So you might need to cut the clothing away to see what you're dealing with, because if you're going to take the clothing off in the normal way, you could make it worse and spread the blood everywhere, which is messy. So expose the wound, then examine the wound. So you're looking at the wound to see how deep it is, how big it is there anything in it. So if there's loose debris in the wound, like grass or dirt or grit or gravel or sand or something like that, we need to wash the wound out. So we need to clean the wound. We wouldn't do the 4th stage pressure on a wound that's full of muck. So make sure we clean it out. You can use tap water for that, it's not a problem, bottled water, or if you've got some of the little eye wash pods, if it's a travel first aid kit, then use those to try and sluice and wash any loose debris out of the wound. Now, if there's something stuck in the wound, something embedded in the wound, don't pull it out. And I'll do that, I'll cover that in another video. So look for a video about embedded objects and I'll show you how to deal with that. Because if you pull that item out, you could actually make the bleeding worse, which we don't want to do. So I'll talk about embedded objects in another video. So we've got our wound that we've cleaned, we've washed it out, and there's nothing else in the wound. So now we add pressure. So this is the point at which we want to stop the bleeding. We're going to slow down the bleeding. Now, you have to do this for at least 10 minutes. It could be up to half an hour. If a wound is bleeding for longer than 30 minutes, then you may need to call 999 or take the person to hospital, because if a wound's bleeding for 30 minutes, it's probably not going to stop with the equipment that you've got available. So give yourself that 30-minute ceiling on treating somebody that's bleeding. But it might take 10, 20 minutes because we're waiting for those platelets which swim around in the bloodstream to clot together and coagulate, to fill, to harden and solidify, to fill the gap, the damage in the blood vessel, which is why the blood is escaping. So let them do that. Take your time. Don't expect the bleeding to stop just within a minute or so, because it probably won't. So that's probably a good idea that you're both sitting down, isn't it? Now, to stop the bleeding, you must always wear your gloves. Yeah, it's a bodily fluid, it's biohazard, you must wear some first aid gloves. So put those on first of all. And use anything you've got really that's clean. So it could be a tea towel, it could be somebody's scarf. A good one is, if you've got a first aid kit, grab your sling, your triangular bandage out of the first aid kit, fold it up and use that to press onto the wound. So if a person's sitting on a chair or sitting on the floor and it's their leg that's injured, you can press down against the chair or the floor. If it's their arm that's injured, you can put their arm on a table and then press on that, or on their lap or on your lap and press against that. You need something solid to press against, because it's that pressure that is going to allow those platelets to do their job and stop the blood escaping. You might notice, if you've done a first aid course before, more than a couple of years ago, we used to elevate wounds. So we'd stick an arm or a leg up in the air. We don't really need to do that anymore, because the pressure is far more important and more likely to actually stop the bleeding. And it's hard to press on an arm or a leg that's waving around in the air. As I said before, you need that solid surface to press against. So don't worry about elevation, we can skip that one out. It was just uncomfortable anyway, wasn't it? Holding your arm in the air, get pins and needles. So as I said, you may have to wait 10 or 20 minutes for this bleeding to stop, adding your pressure. Once you feel the blood loss has slowed down or stopped, Then you can grab yourself a bandage. And what you're looking for in your first aid kit are these. They're called dressings or wound dressings. And usually in a first aid kit, there'll be medium and large ones. So open them up and then you'll undo and open the bandage. So I'll show you what they look like. This is a medium dressing. When you unroll it, the short end comes off first, and then you've got the pad that's attached to the bandage, and then the long end. Keep that rolled up, otherwise if it unravels, you'll be in a mess. These are great. They're easy to put on because the pad is attached to the bandage. And I'll show you a large one as well, just so you've got an idea of the difference in the size of the pad. You can see that pad is a lot bigger than the medium one. So obviously get the one depending on the size of the wound that you're dealing with. So there's the large one. Don't touch this pad. It's sterile. These bandages are sterile. There will be an expiry date on them somewhere. So if this is a workplace injury and it's a workplace first aid kit and you're a workplace first aider, you must only use bandages that are in date, so they're current. So open the bandage, the short end comes off, don't touch the pad, then you're going to, if I just move, imagine I've got an injury on my leg, you put the pad directly on the injury, wrap the short end around and get your casualty or somebody else to hold that end for you out of the way. I'll just put it there for now. And then the idea is that you cover this square pad to stop any infection or germs getting underneath. So start unravelling the long end, cover one end, cover the other end, then you know you've done that job, covering the pad, and then keep going until you've run out of bandage. And then with the two ends, you either tie a knot or a bow or whatever, or you could just tuck them in, whatever you want to do, as long as it's secure and it's not going to fall off. Then you're fine. It doesn't have to be neat. You don't get extra points for neatness. As long as this pad is covered, germs and infection isn't going to creep in. It's going to keep that wound nice and safe. If the blood starts to come through this pad, then you probably haven't done the pressure stage for long enough. You might have jumped the gun a bit and skipped it a bit fast. If that happens, take it all off and go back to the pressure stage again for another 10 minutes. So you've got to give that time to work. These bandages don't stop bleeding. All they do is cover the wound that you have now stopped the bleeding from, if that makes sense. So I hope that's been of some help for you. As I said, watch the other video on embedded objects to find out what to do with those. Thank you very much.